start. And thank everybody again for coming. I really appreciate it. Um, so this has been one of my favorite topics for a long time, nutrition and food as medicine. Um, let's see, let me just advance my slides here. My next problem. Um, so can everyone can hear me, right? Can you all hear
Yes,
me?
we can hear you well.
Wonderful. Okay, great. So the reason I like to talk about food as medicine is that the majority of people really don't appreciate the magnitude of their food choices on disease. And unfortunately, what we have here is the American literature, but I do have some from around the world. But if you look at this slide here, and this slide really speaks about the 10 leading causes of death amongst Americans, at least 5 or 6 of these are related to poor food choices. And so that's something that's fairly significant. And in fact, it turns out that the majority of people don't really appreciate the magnitude of their food choices, the dietary factors that affect them. So if you look at this slide, for example, dietary choices factor more prominently in chronic diseases than does tobacco or high blood pressure or obesity. So our food choices are significant in chronic non-communicable disease prevention. This next slide shows that about 45% of the deaths due to heart disease and stroke and diabetes, etc., are caused by poor diet. And so about 80% of diseases can be preventable by lifestyle choices. Now, this next slide, this shows a study that's actually a global study. It's not just an American study. And in fact, you'll find some interesting data on this particular one. This study is published in the Lancet. It's done every year by the Global Burden of Disease Dietary Collaborators, looking at the impact on diet, what we eat, and the global burden of non-communicable diseases. Now, by non-communicable diseases, I mean cardiovascular disease, cancers, and type 2 diabetes. And what you see here, one of the headline sentences in the article is, "What we aren't eating is killing us." And in fact, dietary risks are responsible for 11 million deaths, 255 million disability adjusted life years. So cardiovascular disease was the leading cause of death, followed by cancer and diabetes. And so what aren't we eating that is killing us? It turns out that whole grains, nuts, fruit, and vegetables and seeds are what we are not eating, and we should really also limit the amount of salt that we're eating as well. So now this is the one I think that you'll find very interesting in terms of death rates. The United Kingdom ranked number 23 in terms of global death rates, but look at the United States. The United States ranked 43rd, behind Rwanda and Nigeria. And I know that would come as a surprise to many people. I know that when I give this talk to American audiences, they're very surprised at the positioning of the United States in terms of communicable disease. What it turns out to be is that and I don't know how many of you that are listening are physicians or healthcare professionals, but it turns out that we are very good at giving medications to people and so forth. But so far as giving them the power to reach up and turn off the faucet, we're not very good at that. So what it's like is as if we're mopping the floor and the faucet is still running. So what I really want to cover is consensus views in the literature on nutrition. And unfortunately, all I have is, what Americans eat. I don't know what many in various areas of the world eat, but I know that so far as America, I know what Americans eat. And the other interesting thing is, my husband and I have actually done some work in and Zambia and so forth, and other countries in Africa. And my husband has noted that when he first began to go many, many years ago, there was no cardiovascular disease. But as McDonald's came in and Kentucky Fried Chicken came in, he noticed that more and more people have heart disease. So if you look at the literature, it's very difficult to make sense of nutrition studies. And nutrition studies, this slide is designed to show you the difference in height of buildings. There are some short buildings. There are some very tall buildings. There are some medium-sized buildings that you see here. But what this is nutrition studies are overwhelming. But what we need to do is to recognize that every new study that comes on the scene contributes to the overall landscape of nutrition studies, and it adds something to the overall weight of the evidence in nutrition studies. So I hope that sets a little bit of a kind of a scheme for what we're trying to accomplish. Now, what I have done, and many of you have probably seen this, if you've seen some of the presentations I've done, is I like to look at it in terms of colors. So, green box foods, yellow box foods, and red box foods. So if you look at these things, this is the framework, the categories that we're gonna place food in. And then we're gonna look at the fact that, for example, the foods in the green boxes, they're the overall weight of the evidence, the consensus in the literature is that these foods are remarkably health promoting. And it's very hard to find a study that refutes the idea that these foods are not health promoting. If you look at the red box foods, these foods, again, the overwhelming evidence, the broad consensus is that these foods produce harm. And there's very little data to suggest that these foods do anybody any good. In terms of yellow box foods, the yellow box foods really have not as much evidence. The evidence kind of goes both ways, and that is because these foods are being compared to the red box foods. So when you compare the poultry, that's the chicken and the turkey and whatnot, and dairy and fish to the processed meat and the red meat, they don't look as bad. But I want to show you what really the evidence suggests. Unfortunately, the majority of people prioritize their calories, their food intake in the red and yellow box foods. So we really want to be careful with that. Now, this slide, what I'm going to do is to go over individually all these various kinds of foods, the processed meat, the red meat, the added sugar, refined grains, and we'll look at each one and see what they're all about. So processed meat. Any meat that has been cured or smoked, fermented, or have added preservatives. In the States, we have things like hot dogs and bacon and salami, pepperoni, that kind of thing. But any meat that has undergone this kind of processing, we call processed meat. So processed meat can be either red or white meat. Deli meats are processed meats, and they go through some special treatment. Now let's look at the red meat. Actually, this should be down a little bit. This red meat. When you look at red meat is any mammalian muscle meat. Scientifically, pork is not the other white meat, as many people like to think of it. It's not really the other white meat. Red meat is any mammalian muscle meat that has high myoglobin content. And that high myoglobin content, when it's exposed to oxygen, becomes oxymyoglobin, and that is very difficult for patients. Now, the thing I really want to focus on, which is really an issue in the United States, is something they call carbs. So we're going to look at whole grains. That next thing on your slide was refined grains. So the anatomy of a grain is very helpful. So a grain is composed of three parts. There's the bran, there's the germ, and the endosperm. So, and then on the side of the slide here, you see all these things, the whole grains, a wide variety of things, including brown rice, even corn, millet, wild rice. And then you have these pseudograins. Pseudograins really botanically are seeds, but they function as a whole grain. So many of us eat quinoa, and we're familiar with quinoa. But if you look, on the other hand, at a refined grain is a grain that is stripped of the nutritious bran and the germ, and all you have left is the endosperm. If you look at the endosperm is really a nutritionally depleted food. It really has very little nutrition in it. And so, for example, in our grocery stores, we often see a sign like this. And now, by the way, what I want to say about this lecture, when I give this lecture, I like it to be very interactive. And I know it's more difficult on Zoom to have it more interactive. But I say to people, you know, doesn't that bread look delicious? And it does. And by the way, it probably is. I got this picture, but just to illustrate a point. So the label on the package will say something like wheat bread, multi-grain, 7-grain. But then you look at the label, and the label says unbleached, enriched wheat flour. And what I tell people is that is a marketing trick to make you buy this bread, because what you actually want is that the very first word here should be whole, like whole grain. So if you think about this, this bread is a marketing trick. As long as it says whole, then you're in very good shape. And that's really what you want. So a refined grain is a grain that has the bran and the germ stripped from it, and you're left with a very nutritionally depleted food. If you look at this next slide, I like this slide because it deals with carbohydrate. So there's the whole grain and there's the refined grain. And it's kind of sad because, you know, you're lumping fruit with candy and spinach and kale with donuts. And it really does not work to lump those in the same box. So it's the foods like this group over here. This is the food that really gives carbs a bad reputation, because nutritionally, it really does not make sense to have them all together. So they're two very different camps. So the next one is ultra processed foods, and I apologize. This blue part is not synced up properly, but ultra processed foods. Ultra processed foods are highly palatable foods. They're scientifically engineered, industrially produced to keep people coming back for more. These foods are some of the most damaging foods to the human being. So, for example, I don't know if you have in your country there in Kenya, and by the way, we have spent some time in Kenya, and we've traveled around your country and so forth, and it's a beautiful country, we love it. We were actually at the headquarters there in Nairobi, church headquarters in Nairobi, a few years ago, probably about 10 years ago now, as we were heading out for a safari. But anyway, I don't know if you have something called the plant-based meat alternatives like Beyond Meat or the Impossible Burger. In the States, they've done that. But it turns out that these plant-based meat alternatives are ultra processed. They're highly palatable. They are calorie dense. And anything that made them plant-based, all those wonderful phytochemicals and phytonutrients have been removed to give somebody what appears to be a delicious alternative to meat, but they're just as bad. Now, I find that this is a very important study. This is actually a group of nutrition scientists that meet every 5 years to advise the US Department of Agriculture what is the recommended diet for Americans. I suggest that this diet is actually the best diet for the world. As I showed you at the beginning, that study with the global burden of disease, what we aren't eating is killing us. The very same thing applies. So this is a secular committee. It's the Dietary Guidelines Advisory Committee. And what they have suggested is that a diet higher in plant-based foods, such as vegetables, fruit, whole grains, legumes, nuts, and seeds, and lower in calories and animal-based foods is more health promoting and is associated with less environmental impact than is the current US diet. Now, what's very profound actually is that this group met for the last time in 2020. We all remember what happened in 2020 and is still actually going on today, and that is COVID. Now, look very carefully at these additions that they made to this 5-year cycle of recommendations to the US Department of Agriculture. The two additions are that they consider the role of the gut microbiome in future guidelines. I will speak about this a little bit later, but it turns out that the gut microbiome can either work for you or against you. It can promote your health or it can cause a decline, in fact, a demise of your health. So that's very significant. We're going to come to that in a little bit. The second addition was they want people to examine the relationship between nutrition and the immune function. This has come about as a result of COVID. Because of COVID, having the identical risk factors for getting severe COVID as those who get cardiovascular disease, this group decided that there is a connection between what you eat, your nutrition, and COVID. So that's why that recommendation was added. And I thought that was an absolute must. And I was very excited to see that that was done. There's a nutrition writer, his name is Michael Pollan, and he wrote this very simple statement: eat food, not too much, mostly plants. And that's, I think, a very simple way to look at things. What is a plant-based diet? Basically, a plant-based diet is a diet that derives the majority of its calories. And by that, I mean 80 to 100% of the calories that we eat from these health promoting green box foods. And you look at this beautiful picture and you see all the legumes and the nuts and the fruit and everything. Beans are so good for you. Beans and lentils, very good for you. So I think, so that's really what we're looking at. Now there are two, well, first of all, let's look at this Mediterranean diet. So the Mediterranean diet, first of all, I want to be sure everyone understands that this is not a homogeneous diet. It really relates to geography and time. This Mediterranean diet, in 1993, the Harvard School of Public Health there in Boston, as well as the European Office of the World Health Organization, kind of got together and introduced the items in a Mediterranean diet, the diet pyramid, to the world so we could understand what the region eats. Now, this region is significant because these people in Greece and Crete and southern Italy had decreased access to healthcare, but yet they had very low mortality and very few chronic diseases, and they actually lived longer than the other population. And so the question was, what is it about this diet? If you look at this slide, this diet really varied by place. Was it in southern Italy or whatever? You got points if you ate grains, beans, fruits, vegetables, olive oil, fish, and small amount of wine. I will come to that, don't worry. You lose points if you ate dairy, poultry, and red meat. Now, the benefits they were looking at was reduction in these non-communicable diseases, cardiovascular disease, cancer, and diabetes. Two major areas of study. One of them was a primary prevention study. The other one is a secondary prevention study. And there are actually numerous of these studies. And so they had some significant findings. And as you look at this slide, as I bring it up here, there have been tons of papers written on this, tons of papers written on this topic. And the question was, what is it that gives these people a better outcomes? Is it the wine? Is it the fish? Is it the olive oil? And when they deconstructed the data, what they found was that it was not the fish, the olive oil, or the alcohol, that wine, that was the primary benefit. If you ate more meat, you got worse outcomes. However, more plants, better outcomes. So the bottom line of this study was that it's actually the plants that really confer the benefit of this diet, and it was not really the olive oil, etc. Now, this next thing I usually do as a quiz, and I don't know if maybe some of you can answer a little bit. Which of the following is the number one source of calories among Americans age 2 and up? Does anyone want to offer an answer? Is it sugar sweetened beverages like soda pop? Is it dessert? Is it breads, bagels, rolls? Is it cheese and cheese products? Does anybody want to respond? Yes? Is everybody there?
C.
C, okay, they get C, all right. Well, actually, it's interesting because it's actually dessert. So if you look at Americans, more than 2 years old, grain-based dessert, cookies, cakes, pies, etc., nothing that you eat, but this is the number one source of calories in the American diet, if you can believe it. Now, I want to know number two. Any guesses on number two? Number two is actually breads, which is white bread, and those refined grains. Now, I don't know if you have, in your country, I think this is important. Now, in your country, guess what would be the number three source of calories in the American diet? And my suspicion, it might be the number one source of calories in your country. What do you guess? What kind of food would it be?
Soda.
Soda. It's not, okay, so it's not soda. Soda is coming up, but it's not soda. It is actually chicken. Chicken. So you will not believe this, but Americans eat 1 million chickens per hour. 25 million chickens a day are eaten by Americans. I think that is really significant. Now, you had mentioned soda, and actually soda is number 4. So if you look at this so far, we have grain-based desserts, breads, chicken, soda, and so forth. The last one is one that I know you don't have in your country, and it is pizza. It's in a category all by itself. But if you look at these, I've put these in red because these really are these are all red box foods. And with the chicken, it also involves the yellow box foods. If you look at this next slide, this is disturbing because 70% of our calories actually come from processed and ultra processed foods. So if you look at this, if you look at the blue section right here, what you see is these are these industrially produced things like breads, dessert, salty snacks, soft drinks, pizza, and breakfast cereals, etc. And then 12% is from added sweeteners and oils and animal fats and foods made with cheese and processed meats. If you see this kind of an orange color, it says 30% of the calories come from this. Actually, 14% of that 30% is meats, milk, and eggs. And 14% is the grains, the root vegetables, legumes, and so forth. So actually, when you look at where Americans are getting their calories, only 14% are from the green box foods. So we clearly have a lot of work to do. A paucity of our calories are coming from these foods. Now, what I want to do for this next section is we're going to move to specific diseases. And we're going to speak about two of these, cardiovascular disease and insulin resistance. And the very first one we're going to speak about is cardiovascular disease. So there are two people groups that I'm really excited to talk about. And one of them is the blue zones. And I'm excited about this because the blue zones include a Seventh-day Adventist stronghold, Loma Linda, where I came from, and other parts you see in Italy and Greece and Okinawa, Japan, and also in Costa Rica. But these blue zones are interesting because these people enjoy extraordinary longevity. And the foods that lumps these together is down here in the bottom of the slide, the grains, the whole grains, the legumes and fruits, etc. Diets rich in whole plant foods. This is what they eat. If they eat meat at all, it's at the side of the plate. For holidays, they do not feature prominently on the plate. So that's a really significant thing. Now, this next people group, has anybody heard of the Tsimane tribe in Bolivia? Have you guys heard about the Tsimane people?
No.
Okay. So the Tsimane people are very interesting. It's a very remote tribe in the Bolivian jungle. And these people only are sedentary 10% of their waking hours. So when they're awake in the daytime, only 10% of them are spent in idle endeavors. And their diet is very special. So the American College of Cardiology went to Bolivia to find out what is it that really seems to have these people so healthy. In our country, and I think around the world actually, there's something such as it's an imaging study. It's called a coronary calcium score. It's like a CT scan that measures the calcium buildup in your coronary arteries. And it's a very excellent screening tool for heart disease. And so they went and studied these people. And from 2014 to 2015, they scanned almost 1,000 of these native people. And what they found was that the coronary calcium score was 0 in 85% of people that were under the age of 65, like between 50 and 65 years of age. They had a 0 calcium score. Only 2% of them had a moderate or severe risk of coronary artery disease. I mean, that's amazing. Then they studied the people over the age of 75, over 75 years old. The findings persisted. Now only 65% of them had a 0 calcium score, and only 8% of people in this tribe over the age of 75 had any significant coronary artery disease. Now, in the United States, they measured the coronary calcium scores to compare these people to amongst 7,000 people aged 45 to 84, and only 14% of Americans had zero risk. I mean, that's really, really significant. So whereas over 75 years of age, 65% had zero risk of coronary artery disease. In America, only 14% have zero risk over between the age of 45 and 64. So then the question is really, what do the red box, green box, and yellow box foods have to do with cardiovascular health? And this study right here is significant because this was a comprehensive summary of the accumulated evidence-based prospective studies regarding adverse health effects of red meat and processed meat on diseases like diabetes, cardiovascular disease, and cancer. And the findings really were quite significant in that if you look at the slide, compared to a baseline, these kinds of foods have significant contribution to cardiovascular disease and cardiovascular risk. These next three studies right here, I'll just go over them very briefly. Dr. Timothy Key recognized that, and this was back in the 1970s, he began to look at Seventh-day Adventists in Southern California, because he noted that they had less mortality, less cancer, less cardiovascular disease, less death from all these things. And he began to look at these people and say, now, what is the difference between these Southern California people and people elsewhere? So he did a prospective study over 20 years. And he recognized that, and what he randomized it. So he picked some vegan vegetarians, and they went and got 5,000 of their friends that were not vegan vegetarians. He looked at both groups over 20 years' time. What he noticed is that they have decreased mortality and an enviable decline in ischemic heart disease amongst the vegan vegetarians compared to those who ate meat. 24% less mortality. This was actually a mortality study. But again, this was a prospective study, the best kind you could look at. And let me just go back a second. That second one there by Dr. Huang, another mortality study, he also looked at very similar data. His was a meta-analysis and a systematic review of all the literature looking at these different populations. And again, decrease in mortality. The EPIC Oxford study is done actually in Europe, and the incidence of coronary artery disease, ischemic heart disease, was significantly less in vegetarians compared to non-vegetarians. So the question is, what is it about meat? And this slide, I do want you to really pay attention to this slide because it's really important. The question is, what is it about meat and eggs? You see here, we have meat, eggs, and we have cheese. There's cheesy eggs and meat. What is it about these animal products that actually have such a detrimental effect on health? One thing they figured out, and there have been a number of studies that have been published showing a link between the gut microbiome or the gut flora and atherosclerotic cardiovascular disease risk. The first paper was published in the journal Nature, which is a very prestigious worldwide journal, and that was in 2011. Since then, they've been published in many other journals, including the New England Journal of Medicine and Circulation, the journal Circulation. And what they found was that long-term eating pattern affects the gut bacteria. That is really, really important. So long-term eating patterns affect the gut bacteria. So it's not just, things we think about like heme, iron, or whatever, but it's what we eat. So what happens? Well, when you eat these kinds of food contain compounds like phosphatidylcholine. They can also contain another substance called L-carnitine, and that actually is what's in red meat. If you look at eggs and so forth, fish, those have phosphatidylcholine, and the L-carnitine is in the red meat. When you eat phosphatidylcholine or carnitine, what happens is that the gut bacteria converts these substances into trimethylamine. Now, trimethylamine is oxidized in the liver to trimethylamine N oxide, TMAO, a very toxic substance on the body. So it's converted, it's oxidized to that, and it becomes converted. What does it do? It increases uptake of cholesterol by the macrophages. It increases foam cell formation. It increases platelet aggregation and decreases the hepatic clearance of cholesterol. The end effect then is mortality increases, cardiovascular mortality increases, major adverse cardiovascular events like heart attacks and strokes and congestive heart failure, all those increase with this TMAO. It's a very toxic substance. So what's also significant is, they tried to give, you can actually measure this substance in people who are going to like they've had a heart attack, they go to the hospital. This actually, you can actually check this, and this will determine in 30 days the likelihood of a recurrence happening. So, and in addition to that, they tried to give vegans L-carnitine, or they wanted to eat a steak, first of all, and they refused. They said, we're not going to eat that. And what ended up happening was that they gave them the pill, but one pill won't affect your cardiovascular system. What affects the cardiovascular system instead is eating a lifetime or a habit of eating these kinds of foods. So that's the issue there. And if there are any questions about that, you can ask me those after we're done with the talk. Okay, now, okay. Let me just grab one. I'm just trying to grab one thing here. Okay. This slide shows sugar. Now, I don't know what happens in your country, if your country is like the States in terms of cereal, but this particular study, it really looks at two different studies. One of them is sugar intake and cardiovascular disease mortality amongst US adults. And this has to do with the fact that the more sugar you eat, the more chance you are of having a significant problem. So if you eat, for example, let me just get this, let me just get another thing in the slide, there we go. If you eat 10% of your food in sugar, the chance of having a cardiovascular event is significant. In fact, it's 30%. The hazard ratio is 30%. In other words, you're 30% more likely to get cardiovascular disease because of eating this. 25% of the calories from sugar will also cause even more cardiovascular risk. So that's another significant thing. Now, what we also know is that the glycemic load of the particular food is important. Not every food has the same glycemic load. So the glycemic load really has to do with what does that food do to the insulin level when you eat it? Does it spike the insulin high, which is associated with getting cardiovascular disease? So what happens when you eat these foods? And that's what that is really about. All right. So the sugar itself is a problem, and also the glycemic load of the food, the quality of the food is also the problem. So the question is, what is it about the carbohydrate, the sugar, that causes a problem? So if you look at this, High carbohydrate diet, and by this I mean the refined sugars, raises the plasma fasting triacylglycerol by enhancing synthesis of VLDL in the liver. It reduces the healthy cholesterol. It creates an adverse lipid profile. And the greatest effect is those with an elevated body mass index. So the heavier you are, the more the chance of having something like that happen. Okay. And then now this is another study. It was just published in the New England Journal of Medicine, April 8 of 2000. This should be 21. This was a typo that I have here. I'm sorry about that. But April 8 of this year, this study was shown. And what they did is they looked at the glycemic load and cardiovascular mortality. And again, it was huge. It's better to eat the apple than the refined grains. All right. So far as Americans go, the American system has advised that Americans eat, women, 6 teaspoons of sugar per day, no more than that. And also they're recommending that men only eat 9 teaspoons of sugar per day. So that, and that's really quite a bit. When you think about that, that is really quite a lot of sugar that we're talking about. Now, this next slide, this is an important slide in that it really looks at the dose-response relationship between the intake of sugar, or of fruits, and benefit, cardiovascular benefit. So they looked at several studies, and what has come to light is that 2.5 servings per day of fruit and vegetable decrease the cardiovascular risk by 8% for coronary heart disease, 16% for stroke, 10% for all-cause mortality. And what's important about this is that the benefits continued up to 10 servings a day. Many people will say to me, okay, so what is 2.5 servings of fruit a day? 2.5 servings of fruit a day is a small banana, an apple, and some broccoli. So 2.5 servings a day is beneficial, and these are the numbers right here, but they increase up. In other words, you can have up to 5 times this number with increasing benefit as you increase your fruit intake. Okay, and so it's really interesting because every time I talk about this, there's always somebody that talks about like, well, French fries, mashed potatoes, those are plant-based. Well, the Harvard School of Public Health has done a very nice job of putting together multiple studies. And as you can see here, this is 4.8 million person years of follow-up. This is the Nurses Health Study and also the Health Professionals Study. Based on this study, they divided out plant-based diet index, and this is looking at the healthy plant-based diet index versus the unhealthy. If you look at this, I wrote these down here. So the healthy would be the whole grains, the fruit, the vegetables, the nuts, the legumes, vegetable oils. Whereas the unhealthy are the high in fruit juice. That's even fruit juice, even the orange juice. Any juice is too concentrated and there's no fiber in it. Refined grains, fried potatoes, that's the French fries, chips, the sugar sweetened beverage, that's the pop, sweets and desserts. When you separate that, now look at this next slide. This is really significant. If you look at this, you probably can't see these very well on the screen, if you can see my pointer moving here. But if you look at the overall plant-based diet, overall, with all the healthy and unhealthy included together, it looks like the benefit is slim, about only an 8% reduction. However, when you look at the healthy plant-based diet, now we have a 25% reduction in cardiovascular mortality and a 32% increase of cardiovascular problems with an unhealthy plant-based diet. So what I tell people is this: when you eat plant-based, make sure that that plant-based diet is the healthy plant-based diet and not, you know, what people would think it is. All right. Um, okay. Now, so this is a wonderful slide because this tells us that plant foods and cardiovascular health have several mechanisms by which they benefit those who eat it. So the more plant-based food you eat, the better off you're going to be. Why is that? It replaces the disease-promoting foods. It reduces the uh, LDL oxidation from happening. It improves the endothelial function and reduces inflammation. I'm going to come back to those two. It's amazing. And it is beneficial, it beneficially alters the gut microbiota. As we mentioned already, when you eat meat, it changes the gut microbiome so that that gut microbiome now changes your food into poison. A person who is plant-based has a completely different gut microbiome than somebody who is not plant-based. So that's really important. And it also decreases your lipid, it decreases your blood pressure. Now, let me tell you about this. So there is such a thing as called inflammatory storm. You have seen this in COVID. If you see COVID pneumonia, the cytokines that are released, that is inflammatory storm. Well, what happens when you eat meat and so forth? You know, we're used to thinking about cardiovascular disease in terms of in in a few years you might have cardiovascular disease. If you eat like this, you can get hardening of the arteries and get a heart attack. We don't think of it in terms of the minute by minute, moment by moment, hour by hour effect that the food is having on our body. What we now know is that certain types of food like meat and the chicken and the dairy products, these foods create an inflammatory storm in the body. So what happens is this: the blood vessels auto-regulate. They can vasodilate or vasoconstrict based on the need. When you eat these foods cause an inflammatory storm that stuns the blood vessel so it can no longer vasoconstrict or vasodilate. And people will experience these difficulties. For example, my husband's a cardiologist. He noticed that when people go out like to McDonald's and eat a Big Mac and some bacon and so forth, they will come into the hospital with a heart attack. And that is because the body's ability to vasodilate when it needs is no longer present with these people. So compared to a bowl of oatmeal, if you eat bacon and eggs and cheese and a burger, these will impair the body's ability to auto-regulate. It really produces endothelial dysfunction, and that's the issue. And there are a number of compounds, such as TMAO, and there's another substance called new GC5. All these inflammatory compounds are produced when you have somebody who has inflammatory storm. So that is that section on cardiovascular disease. Now I want to talk about something that we see often, that's insulin resistance. And the question is, what does the red, yellow, and green box foods have to do with insulin resistance? In the United States, and I wish I knew what it was in Africa, half of the adults have either diabetes or pre-diabetes. That is significant. And if you look at this, remember this, you've seen this slide before when I talked about cardiovascular disease. Now we've added diabetes to it. This Dr. Volk did this study and recognized, first of all, that meat is a public health concern. What is the issue in terms of type 2 diabetes and meat? And people will oftentimes say, you know, what the issue is with the meat is that it, with diabetes, is that the sugar is the problem. It seems fairly intuitive. And in fact, in America, we used to tell patients, don't eat fruit. It'll make your blood sugar go up. But this is important. The risk of type 2 diabetes with meat is this: there are a considerable number of prospective studies that have consistently shown that a diet rich in red and processed meat is associated with an increased risk of type 2 diabetes mellitus. Now, recent studies show that for every 50 grams of processed meat you eat, the fasting blood glucose was significantly higher. For every 100 grams of unprocessed meat, both the fasting blood glucose and the insulin levels were significantly elevated. So what is the problem? Why is it that red meat and processed meat are causing such a problem? Well, I hope you can see the slide. It's kind of cool. In the background of the slide, you see a child reaching up to unlock a door. And so insulin is the key that unlocks the door. There is a complex mechanism actually that allows the insulin to work on the cell. And so if you look at what happens when you eat saturated fatty acid, it elevates intracellular fatty acyl-CoA. This is important. This results in a decrease in the insulin activation of the mechanisms within the cell that allow glucose, the receptors, to go up to the surface of the cell and take the glucose in. And so specifically the compound, the name is not so important, but it's activation of the insulin receptor substrate, phosphatidylinositol 3 kinase in the muscle cell, also in the liver cell. This causes decreased insulin-stimulated glucose transport activity. So let's just explore this a little bit. This picture shows here a banana. The banana is not really the problem. This could be any piece of fruit, but we chose a banana. So the banana represents fruit. So this is in a normal person with no insulin resistance, just like you and I. When you eat a banana, insulin comes out of the pancreas. It attaches to the insulin receptor on the skeletal muscle or the liver cell. A series of intracellular things happen that allow this GLUT4, which is the vehicle by which glucose is taken into the cell and utilized. So this is a normal person. Well, what happens when someone has insulin resistance? So you eat the same banana and causes glucose to increase. Insulin spikes. It's supposed to attach to its receptor on the cell surface and supposed to absorb, to have these mechanisms, get the GLUT4 to go to the surface and take glucose in. But instead, what is happening is the mechanism is impaired because the lipid subtypes, remember I mentioned before that diacylglyceride that's in the cell? This is obstructing the mechanism so that the GLUT4 is not going to the surface, and now glucose is circulating freely in the cell. At this point, many people want to blame the banana or blame the fruit. Well, the fruit is not the problem. The fruit is just an innocent bystander. And now the fruit gets blamed. And in fact, recently, I had a patient in the hospital here recently that had a very uncontrolled diabetes. The blood sugar was very high. He had something called diabetic ketoacidosis. And he had been to another hospital, not our hospital, another facility. And they told him not to eat the fruit. They needed more meat. So before he came to our hospital, he had stocked up his refrigerator on steak, if you can imagine that. He stocked up on steak. So I thought that was really quite funny. I said, no, I gave him this lecture I'm giving you now. I said, but that's not actually what you want to do because the meat is causing the problem. So what is the mechanism? This researcher here, Dr. Schulman, he is from Yale University here in the States, an endocrinologist and a scientist. And he recognized that what is going on here is that you have ectopic fat building up in the cell, causing insulin resistance. What it does, so far as the skeletal muscle is concerned, is to decrease glucose uptake. In the liver, it causes decreased glycogen synthesis and increased gluconeogenesis. And so you ask yourself the question, why does it get there? Well, in the United States, it's because mostly of adiposity and excess calories and excess dietary fat and inflammation, oxidative stress, and so forth. So these things right here are the main reason that you see increased fat in the skeletal muscle. And the way this was quite a very elegant study in that they used the magnetic resonance spectroscopy to show that there's fat building up. We've all seen fatty liver, and that's what this is. It impairs the function of the mechanism to get glucose out. Now look at this slide. The risk of diabetes. If you look at the risk of diabetes, processed meat, 37% higher risk of diabetes, 17% higher risk with diabetes with red meat, sugar sweetened beverages, 21%. If you combine these two right here, you end up with 54% increase risk of diabetes with processed meat and red meat compared to the sugar sweetened beverages. This is really significant. There are a whole host of mechanisms why this happens, and not to belabor the issue, but if you look at this slide is looking at red meat and processed meat causing type 2 diabetes, insulin resistance, type 2 diabetes via a whole host of mechanisms that are fairly complex. So this is a very, very significant study that I want you to really grab hold of. These next two papers, again, looked at the recommendation in the States. I don't know what it's like in Africa, but in the States, they're telling diabetics to eat low carb diets. And that's because, as I mentioned at the beginning, they're confusing the carbohydrates from the whole grain carbohydrates to the refined grain carbohydrates. Yes, the refined grain carbohydrates are bad. But what they found was Dr. Bao, a wonderful researcher, did some work looking at the nurses' health study, followed over a long period of time. And those women who went on a low carbohydrate diet, increasing protein and fat from meat, ended up with more diabetes than those that did not. And these two other papers, the identical thing here as well. Now, initially, in the short term, these two papers look at the short-term effects. In the short term, you may get a little bit of glycemic control, but beyond 1 year, long term, there is no improved glycemic control using a low carbohydrate diet. And that's really the issue there. Now, one other thing, in this group of studies up here as well, some of the women were eating a plant-based protein and low carbohydrate. In those people that had plant-based protein, that were beans and legumes and vegetables and so forth, they did not have the same outcome. So the protein source is the issue. The protein source is the issue. This next slide, I don't want to leave sugar off the table again. And so what we're going to look at is how is it that sugar sweetened beverages end up causing diabetes? And there are two pathways. One of them is they cause lipogenesis in the liver, causing fatty liver and lipotoxicity, like we had before, the slide from Dr. Schulman from Yale. They also have empty calories. You can gain weight and get obese. And again, lipotoxicity is the same thing. All right. Now, as you look at this slide, what type of food is most protective against type 2 diabetes? And I know that you're thinking of all these things like cruciferous vegetables or berries, whole grains, or fish. Actually, the answer is whole grains. And so it's whole grains. They have 13% less risk of diabetes eating whole grains. And what is the mechanism? It's a wonderful mechanism. The mechanism basically that it improves postprandial glucose response. It lowers the calorie density, increases satiety. It is metabolized by the gut bacteria to form short-chain fatty acids. Short-chain fatty acids are wonderful compounds because they increase this glucagon-like peptide that increases insulin sensitivity. Just these It's so the component is called cereal fiber. Cereal fiber. That's what's doing all this wonderful stuff. It regulates cytokines to decrease inflammation and improves mitochondrial function. So carbohydrate, imagine whole grains, which are a carbohydrate, actually improve glycemic control and lowers the risk of diabetes via cereal fiber. And I find that to be most helpful. All right. Now, this is my favorite study. And this study looks at a study that was done in China. And in the interest of time, I'll just tell you briefly. It was the first study of its time. It was a prospective study looking at 500,000, 500,000 adults studied for 7 years, looking at their daily consumption of fruit. In China, they recognized that many people in China is a diabetes hotbed. And what they found out is that the people will eat vegetables, but they avoid fruit because it's like fruit causes a problem. But actually, so they gave them fruit. And they had both those who already had diabetes and those who had no diabetes. So daily fruit consumption had a 12% lower risk of diabetes. In those who had diabetes at the baseline, 3 times a week fruit lowered all-cause mortality. And then the microvascular complications like eye disease and kidney disease and neuropathy, those complications decreased by 28%. And the macrovascular complications like stroke and heart attack were decreased by 13%. So this is a very nice study, the first of its kind, prospective study, looking at introducing fruit into a population of patients that were against fruit because of the myth that fruit causes diabetes because of the sugar content. So fruit is not guilty. It's not the cause of our problem. Looking at this one here, so the Nurses' Health Study again, this one also looked at a healthy plant-based diet versus an unhealthy one with the identical kinds of findings. You cannot eat an unhealthy plant-based diet and hope to get by with it because it increases your risk by 16% for diabetes, whereas a healthy plant-based diet decreases your risk by 34%. Now, I want to point out one thing on this slide. If you lump them all together, both healthy plant-based and unhealthy, the risk is decreased by 20%, but by itself, healthy plant-based by itself, 34% reduction in incidence of diabetes. This was done by Dr. Neil Bernard, and we're almost done with our presentation here. But this Dr. Neil Bernard, if you've studied the nutrition literature and lifestyle medicine, he is a kind of a guru in this area. And he compared a plant-based diet to the American Diabetes Association diet in terms of glycemic control. It was a small study, but it was a randomized control study. They looked at these patients for 74 weeks and found that the patients that had, it was a low-fat plant-based diet versus a conventional a diabetic diet, they had better glycemic control with the plant-based diet and better lipid reduction and weight loss when they were on a plant-based diet. So again, to highlight the significance of this study, this was comparing the American diabetes diet to the plant-based diet. And you see, I have wonderful pictures here looking at what that is, some oatmeal here and wonderful whole grain rice and bean wraps and all kinds of stuff. And the plant-based diet is better for a diabetic than the American Diabetes Association diet. This slide just shows here the hemoglobin A1C or glycohemoglobin. This dark line is the vegan line that shows the hemoglobin A1C being reduced more significantly and with greater durability if they have a vegan diet as opposed to the conventional diabetic diet. And I think we'll stop at this point. I don't have the cancer thing really is very similar. I'll just show you this one slide. And this slide is funny just to show you that Americans are really stuck to their meat. And back in 2015, when the World Health Organization identified that red meat causes cancer and processed meat causes cancer, on one of our magazines, the Time magazine, it said, if you can see down here, the war on delicious. And so I thought that was funny. And then what you see here is that you see here that meat, so the group 1 carcinogen included salami. This is the processed meat, group 1 carcinogen, same as cigarettes. This does not mean that meat consumption is the same as cigarettes. What it means is that the weight of evidence that shows that the plant-based, or excuse me, that the meat diet, the weight of evidence that it causes cancer is just as strong as the weight of evidence that shows that smoking causes cancer. That's all it's designed. Now, so far as pork and beef and lamb, red meats were given a group 2A carcinogen classification. The top classification is group 1, then you have group 2A, which means it probably causes cancer. Group 2B is possible. So group 1 is it causes cancer. Group 2A is it probably does. So as we've been going over this, just to urge upon you the significance of what has been presented here, God made the diet back in Eden. He said of every herb that yields seed, of every tree whose fruit yields seed, to you it shall be for food. And I believe that God was serious. He knew what he was doing. And when he created us and made the diet for us, he knew how he made us fearfully and wonderfully. He made us for health, to be in health. And it's still his desire today that we enjoy the kind of health that he designed us to be. Thank you so much.